Always low prices at Pahrump Valley Auto Plaza.
So Huntridge Family Clinic is a primary care clinic that has our primary location in Las Vegas, and we are in Pahrump the first and third Wednesday of each month, trying to engage community partners around testing for HIV, hepatitis. We're offering services around medication-assisted therapy for those individuals who are struggling with substances. We do primary care for the LGBT community as well. And the goal of being out here each week or each month is to help bring some services to Pahrump. Nevada, is disproportionately impacted by HIV and hepatitis and substance use, and that's a big focus for the clinic. The clinic has been in operation since 2013, and our primary mission has been to engage the communities that have disparities in health, like people struggling with substance use or people living with HIV, our trans communities, our LGBT communities in a kind of an affirming care environment. So our mobile unit can actually do anything and everything that we do in our physical office in Las Vegas, we can do on the mobile unit. So if you want to get tested for HIV or hepatitis, we can do that here. You'll have your results within 20 minutes. If you need to engage in care for something, we can do that as well. If you're needing to get, for example, like a well woman's exam, we can do a pap smear on the mobile unit as well. So anything we can do in the office, we can do on the mobile unit. So we are partnering with Nye County Health and Human Services through our relationship with the Ryan White program. And Ryan White is a program that's specifically funded for caring for people living with HIV. And that is kind of what brought us to the Nye County and Pahrump area, was to try and engage patients who are living with HIV in services in your community, to try and help break down one of the barriers of transportation. Because, as anybody that lives out here knows, it's kind of a hike to get into Vegas, and we're trying to bring care to the area where you live, and that's how we got here. We also kind of partnered up with the health district out here to help engage in testing, to get services for testing for people that want to get tested for HIV, hepatitis, gonorrhea, chlamydia, syphilis. And then if we have somebody who does identify as positive, then we link them up with the health department out here and get them set up for treatment. But if there's somebody who tests as HIV positive or hepatitis C positive, then we'll initiate their care and kind of get it followed up through being here on site 2 times a month to start. So our services are provided in a variety of different ways. If you wanted to get tested for HIV and hepatitis, that testing is free. For any care related, so let's say you're living with HIV, you have hepatitis, or you want to get primary care, then we can work with Medicaid, with private insurances to bill the insurances. If you need to have labs done, we can actually draw them on the unit here, so you don't have to go to Quest or LabCorp. We can actually send it into the lab, and we'll get all the results and everything through the mobile unit.